Introducing Early Intervention, a new integrated approach to health and social care for Birmingham. 7 health and social care organisations have combined forces to deliver early intervention to the 1 million plus population of the city. Working towards 4 key goals, its aim is to provide the right care in the right place at the right time, with a home-first ethos. The programme is also playing an integral role in Birmingham's response to the coronavirus pandemic. The unified approach focuses on 5 areas of health and social care. And this is how it works in practice. Meet Abdul. He's 75 and lives in Birmingham. He was admitted to hospital after suffering a seizure. After a week, the new early intervention multidisciplinary team within the hospital's discharge hub agreed that he was well enough to transfer to a community hospital to continue his recovery. After 5 days there, he was discharged with support from the early intervention community team who would continue to care for him at home. A member of the community team visited Abdul at home to assess his needs and record his details on a central system so he wouldn't need to repeat himself again. At the daily multidisciplinary team meeting, the community team reviewed Abdul's notes and agreed that along with physio support, he would benefit from rehabilitation assistance to get him walking again. A physiotherapist and a rehabilitation assistant visited him twice a week, and within 4 weeks, he was walking again without support. Thanks to the new early intervention approach, Abdul received the right care at the right time in the right place. His stay in the acute and community hospital was kept to a minimum, and he was able to continue his recovery at home. Now meet Alice. She's 82. One day she tripped, fell, and couldn't get back up on her feet. After hearing her calls for help, her neighbour dialed 999. On arrival, the ambulance crew decided she should be admitted to hospital for x-rays. After no fractures were found, the Older Persons Assessment and Liaison team, known as OPAL, assessed Alice. OPAL uses the combined expertise of a multidisciplinary team led by a geriatrician to ensure older people get the right ongoing care and avoid unnecessary hospital admissions. OPAL discharged Alice home with a referral to the early intervention community team to help her with her balance issues, anxiety and depression. The next day, a social worker from the community team visited her to carry out a full assessment. The wider team reviewed her notes at its daily meeting and developed a 4-week recovery care package for her. Alice was visited by a nurse and physio regularly to improve her mobility and safety at home. For her loneliness, the team put Age UK in touch with her, and a mental health nurse also worked with her to help reduce her anxiety and depression. After a month, Alice became more steady on her feet, her mental health improved, and she began enjoying time with friends again. The new early intervention approach helped to ensure that Alice wasn't unnecessarily admitted to hospital and that she received the right ongoing care to enable her to recover at home and regain her independence. She received truly integrated health and social care. More than 1,000 staff are now delivering the early intervention programme across the city, helping to transform the delivery of health and social care in Birmingham. The city's health and social care system remains united in its goals, working together to make Birmingham a great place to grow old in.